Hello, everybody. Thank you so much for joining us today, and I'm so happy to be here. My name is Jahan Casey, and I'm here moderating our panel today on First Nations responses and recovery from the COVID-19 pandemic. And before I go any further, I want to take this opportunity to acknowledge that I'm speaking to you from the traditional territory of the Tsleil-Waututh, Squamish, and Musqueam Nations, here in North Vancouver, British Columbia. It's still morning where I am, so good morning or good afternoon, wherever you're joining us from. A little bit quickly before I introduce our panelists, the First Nations Public Service Secretariat that I'm the director of works with IPAC on a number of initiatives, and we're so pleased to be able to participate and bring this panel to you today. We work with IPAC to support public servants in all levels of government, local, municipal, federal, provincial, First Nations, and since March, that's been a very different type of work for all governments. So today, to talk a little bit about how First Nations have both responded and gone through outbreaks or managing to keep an outbreak from happening in their communities, and also what it looks like to recover and move forward potentially from this pandemic. We have three distinguished speakers, and I'll just provide you a little bit of background information on all three of them right now before we get going. And I'll do so in their chosen speaking order. So Councillor Chris Lewis is the spokesperson and council member for Squamish Nation Council. He was elected to his third consecutive four-year term as a member of the Squamish Nation Council, and he's one of two spokespersons for the nation. He's currently focusing on the following areas: rights and title and intergovernmental relations, education, economic development, governance, planning and capital projects, fisheries, and access to aquatic resources. He sits on a number of boards. In particular, he is chair of the Simon Fraser University Board of Governors. And previously, he was a founding member of the MST Development Corporation and worked for many years at the national and provincial level for the BC Assembly of First Nations, focusing on First Nation advocacy and policy. He was raised by his grandparents and was encouraged to learn the traditional ways of the land, as well as further his academic education. So along with traditional teachings in his background, Chris obtained a BA in Geography and Planning with a minor in First Nation Studies from SFU. And second, I am also pleased to introduce Chief Harvey Macleod. And in his own words, he is a husband, a daddy, a papa, and a son. Sorry, Chief Macleod, I put those in the wrong order for you. Chief Macleod was first elected to the Upper Nicola Band Council in 1982. He is currently the chief of the Upper Nicola Band of the Okanagan Nation. He is also a director for the BC Assembly of First Nations, as well as a team member to the Indigenous Advisory Committee for the Canada Energy Regulator. And finally, I am also so happy to have with us Chief Commissioner of the First Nations Tax Commission, Manny Jewells. Manny Jewells is a member of the Kamloops Indian Band, and he served as chief from 1984 to 2000. He led the amendment to the Indian Act in 1988 so that First Nations could exercise the jurisdiction to levy property taxes on reserve. The Indian Taxation Advisory Board, known as ITAB, and the current First Nation property tax system were created as a result of his vision and efforts. Chief Commissioner Jewells served as chair of ITAB from 1989 to 2003 and 2005 to 2007. He was the driving force between the First Nations Fiscal Management Act, passed by Parliament in 2005, creating the First Nations Tax Commission and the fiscal institutions. On November 11th, 2006, Mr. Jewells was appointed Chief Commissioner of the First Nations Tax Commission. Mr. Jewells was the recipient of an honorary doctorate of laws from both the University of British Columbia and Thompson Rivers University, the Order of British Columbia in 2009, and won the Queen's and Diamond Jubilee Medal in 2013. And I'm going to now turn it over to the three panelists to speak. And I encourage you to think of questions. We'll have, I hope, ample time for questions and discussion amongst the panelists and all of you present after they're done speaking. So with that, I am pleased to turn the camera and the mic over to Councillor Lewis.
Thank you very much. Hatsqual Tanoyap Siams. Good day, good morning, good afternoon to all. I am honored to be here. Thank you for the wonderful introduction and just honored to be sitting on a panel with Chief Macleod and Grand Chief Manny Jewells, and just honored to be here. My purpose of talking a little bit is to provide Squamish's perspective in terms of how we responded to the COVID-19 cluster outbreak in our community, along with the overall aspects. So I'll start right from the top. The nation was quite fortunate in the first wave in the early times of April and March and the early spring that we didn't have any cases. That allowed us to kind of mobilize a little bit and do a few things as we kind of protected our community. We declared a state of emergency, which allowed us to kind of somewhat shelter and close down our reserves to outsiders. And we created signage and all of those types of things to ensure that just the community members that were living on the reserves were occupying and using the reserves there. We also, from an administrative perspective, created a work from home policy because our offices weren't equipped in terms of providing social distancing and all of the health measures that were needed and that were being talked about by Dr. Bonnie Henry in the BC region area. So we developed this work from home policy to really mobilize our staff so that they were equipped with technology and means to work from home. But we still had to lay off, a lot of our workers that were running programs that were offered to our community members, and they weren't going to be doing that as a result of the global pandemic. So we were really fortunate at Squamish Nation up to August 25th. So as we all know, we kind of got through the first wave, and then summer kind of came and we were all allowed to kind of travel a little bit and all of those and kind of reconnect to our communities and our families. But on August 25th, our health director was informed of the first case on reserve for Squamish Nation. 3 days later, that first case went to 9 confirmed cases. As leadership, we quickly closed our offices using the work from home policy, but our essential services continued to run. By August 30th, we were up to 19. So as you can see, it was just spreading rapidly within our tight-knit community. Over the next few weeks, the numbers just continued to climb both on our North Vancouver reserves, along with our more remote reserves in the Squamish Valley. Over about a month, we got up to 43 cases in the community. It was right at the early onset. There was a lot of anxiety in terms of what leadership should do, and it was really up to leadership in our administration and our frontline staff to kind of manage the anxiety and manage the fear. Because people wanted to know who got tested positive, what households was it, and as we all know, all of that information is kept confidential. We are told by the First Nations Health Authority and Vancouver Coastal Health of the numbers, and we really wanted our community members to kind of self-identify to us confidentially so that we could support them. So what happened is we mobilized very quickly around the cluster of cases. We isolated those families in those houses by supporting them. So we didn't want them to go outside. We didn't want them to go get groceries and their medical supplies and all of those types of things. So our emergency services really had to wrap around the house and ensure that the food was getting there, the supplies were getting there, that they were connecting with the health officials and doing everything possible to ensure that the spread was contained, and also ensuring that they were doing contact tracing so that we can ensure if they were in contact with somebody else and all of those types of things. So we really kind of wrapped around, and that took a lot of effort. In the early days, we sent out 710 community care packages to all households on reserve, and an additional 200 packages for our off-reserve members to come and pick up in a safe. This contained fresh and frozen and non-perishable food items, as well as some activities to keep the families entertained. As we try to mitigate the fears, what we did is we went we used media like this, social media. We went Facebook Live on a daily basis. At 6 p.m. every day, I was on Facebook, kind of providing our community members with the numbers. The reason we did this is we really wanted to empower our members to ensure that they were getting the right information, because we all know in tight-knit communities, smaller knit communities, there's a aspect where, you know, rumors can fly and all of those types of things. And we really wanted to combat all of that aspect as well, in terms of ensuring that people were getting the proper information when the nation was getting the information. This also allowed our community members to inform those members that didn't have access to email, such as elders, or access to Facebook, inform them of what was going on. It was really about communications and providing people the information and ensuring that they were given the tools to ensure that we can manage this, as a community. It wasn't just going to be leadership and administration. It was going to take all of us. And really, we backed up onto our traditional teachings, kind of saying, we have been through this before as First Nation people. There's been pandemics in our communities before. Let's lean on our teachings and kind of move forward in all of those aspects. So really, communication was the key. After kind of looking at all of this, and really kind of for the purpose of this panel, is really kind of speaking with our staff and our frontline workers. I asked them kind of on a monthly basis, kind of what do we need, kind of all of those types of things, noting that we're going through this. So as of October 7th, our community has been cleared. There's been one or two cases kind of pop up, but nothing kind of major. We don't get the numbers for our off reserve members. So I think that's really critical to know, because the majority of our off reserve members kind of live in the vicinity of the reserve. But if they had a positive case, the nation wouldn't know about it unless that person or that family self-identified. So I think that's somewhat of a gap. I think that we need to kind of look at, is that leadership don't know kind of what's happening outside the reserve boundaries. We only know what's happening inside the reserve boundaries. So I'm happy to report that we've been cleared as of October 7th. In terms of what we needed really in place, is, as we've heard time and time again on panels like this, we can prepare, but in terms of this pandemic and this virus of COVID-19, our community wasn't, we thought we were prepared, but we weren't, because it moves and infects people so quickly. And it's really about trying to contain and ensure that our people are adhering to the rules. Also, we really need to provide support to those individuals that were directly impacted, because in order for them to self-isolate, for them to stay home in our First Nations communities, especially Squamish, we needed to support them. We can't give them a reason to leave the community or leave their house. We needed to kind of, again, wrap around those supports and really be transparent in terms of the communication. In the early days, it was really important to kind of get beyond that blame, shame, and judgment to a notion of empowerment, where the community was encouraging people, if they tested positive or they were self-isolating, to identify themselves to the nation, so that the nation and the people can support them. And over the time that we did that, we start hearing really success stories in terms of all of those other aspects. On the macro aspect, though, is the Squamish Nation was really lacking a comprehensive pandemic plan that had been trained and exercised. And I think everybody was on that kind of train as well. But it was really, even though we went through the first wave, we didn't develop a plan and really ask leadership and our administration and our community, what do you actually want? We were just happy we got through the first wave. And then when the second ripple started happening at the end of summer, we were unprepared and untrained. So I think developing that capacity. But I think one of the real key issues was burnout. our frontline staff were going 7 days a week, long hours, ensuring that those people were supported. And so when we got a break, everybody kind of took a break instead of starting to look at a plan and all those. So we really, as First Nations, need to plan and need support provincially and nationally to ensure that we have the capacity, human and financial, to ensure that we can replace those people that are in the front lines with other trained people, so that we don't have burnout where people are just burning out because they're going, 100 miles an hour and all of those other aspects. It was also really tough in the throes of the outbreak in our community, or the cluster in our community. Was information was coming at us at a daily rapid pace, and the ability to kind of make decisions on the fly, it becomes very difficult when you're trying to lock down your community and all of those other aspects. So it was really important that we knew ahead of time from leadership and our senior directors and our health director exactly what was wanted and what was needed. Um, there was also a great outpouring of support from the external community, our partners, and just community people outside the community that work with the community wanted to donate funds and time and volunteer. And we needed a full-time person just to deal with that, because I had individuals calling me saying, I want to support the Squamish Nation with PPE and all of these types of things. What do you guys need? Whatever you need, we will provide. And leadership needs to be prepared in terms of knowing exactly what they need at any given time. And so that resilience on a daily basis to kind of know what you need. And what ended up happening is we got a ton of masks and a lot of PPE that we're still distributing to the community, which is great. We've kind of stockpiled that. But there was other kind of needs that we needed, such as kind of food and all of those other aspects to keep our communities at home. So as I mentioned, we delivered groceries and other essential goods to those that were in self-isolation, along with our elders and those families that had immune compromised individuals within their household. We actually provided temporary housing for some of our younger folks, our people that were self-isolating, because I think we have to recognize that in First Nations communities, there's multi-generations in one house. So you might have 3 generations living in a house, and if somebody tests positive or has to self-isolate, you don't want them getting the little children sick or the elders sick. So what we did is we pulled those individuals out and ensured that they were safe and that the community and the household was safe. I really want to commend kind of our partnership with Vancouver Coastal Health and the First Nations Health Authority in terms of providing our information, and in particular when the cluster of cases were high. But even at that level, as a leader, I noticed that their capacity was constrained as well. Once our numbers start going down, the data flow slowed down as well. So our people were used to getting daily updates around the numbers, but we weren't getting daily information anymore. So it was really we had to kind of scale back our communications in terms of that, but also let the community know that it's it's good that we're not getting information. Kind of no news might be good news, but we don't know. So we at a national provincial level, we need to support those provincial organizations like the First Nations Health Authority and our health authorities as well, like Vancouver Coastal Health, in terms of the Squamish's perspective, because I witnessed on that side the capacity constraints as well, where I was trying to get numbers of cleared cases so that I can provide good news to my community. And that information just wasn't coming because they were overloaded as well. Like their system was overloaded and they were already on to the next First Nations, supporting the next First Nations that had a cluster in their community. And so I think for this perspective on a national level, we need to support not just the local community First Nations, but we also need to support those agencies and organizations that support them and provide them information in their time of need. Because if they're not, if us as First Nations aren't getting the information in a timely manner because the agencies providing the information above us are capacity constrained and maybe burnt out as well, is that we really need to kind of ensure that we do all of those other aspects. In terms of some of the supports, I think we would need, noting that we're not out of this, and in BC and Canada, we can see that we're fully into a third wave as we speak right now. The nation would really like support around establishing a response team in terms of developing that comprehensive pandemic plan. I think that is critical in terms of supporting First Nations in that, not just Squamish. And that if they're dealing with multi-agencies around emergency management BC or any provincial agencies, that the First Nations are giving the tools so that they understand the process. And really in terms of supporting capacity around building that plan so we don't lead into burnout and move forward on that aspect, and really ensuring that every household has access to the technology or the information that is being provided. We found that if people weren't given the information, they weren't adhering to the rules. So support around a communications plan and all of those other aspects. And I'll just end here around the whole notion around ensuring that there's proper communications in place is absolutely vital in terms of getting your First Nations community, in particular Squamish, through kind of a cluster outbreak and through this pandemic, because information is key, and they really want to hear from people like this face to face on social media or Facebook Live, which we used as a platform, and move forward with that. So I will end it there from a Squamish perspective and look forward to your questions moving forward. Thank you.
My name is Harvey Macleod, and I'm the Almihom Chief for Upper Nicola Indian Nation. And I'm calling in from, or zooming in from my home in Koshana. That's Upper Nicola Indian Reserve number 1. March 1st came around and was kind of paying attention to what was happening around the world, heard about it, but didn't pay too much mind to it. And then started hearing about what was happening in this country. Yeah, and still never paid too much mind to it. But when the province of BC enforced or put in the emergency, I was in a meeting in Calgary and seeing the seriousness of the situation that we're in, and immediately wanted to come home. There were some flashbacks on some recent events that happened around the world, and the one that came to mind was 9/11. Yeah, I just want to go home and be with my family and be in my community so that we can start preparing for an unknown. What is COVID-19? What is a pandemic? About 4 years ago, the community and the council finalized an emergency response plan. And the response plan was geared to fires and floods and accidents on the highway, semis, and not really geared to very much else. So I got home on the 15th of March, and on the 16th of March, the council and our admin team put into action our emergency plan, meaning that we opened up our emergency ops center and started doing some planning on what are we going to do. One of the first things that we did was start connecting with the outside agencies that could provide us some support. And of course, that was Emergency Management BC. Opened up the communication lines, made sure all of the paperwork was done, got the info on connecting and getting supports. We also made contact with First Nations Health Authority. Made sure our communication lines were open with them because we didn't really know what we were dealing with. And then made connection with our health teams, Okanagan Nation, the local health authorities here in the Valley and Interior Health. So all of the communication lines are opened. And as we were preparing, we seen that the pandemic was getting closer. And we knew we were in for a long haul, and that we were going to be really needing a lot of support, more support than we had in the Emergency Ops Center. We had a really good team, but in order to challenge the pandemic, we knew that this had to be a community effort. And we enforced a lockdown. People stay home. There were a lot of people, a lot of homes in this community and outside of the community that respected that, but there were a lot that didn't really understand and couldn't see why we were going to extreme measures of asking our people to stay home. And we knew that we had to communicate with our people. And how do we do that? Just like Chris did, we looked for a number of ways on how we can get the message out about what was going on and what we were doing, and the plans that we had for lockdown and how we're going to support. And as we got deeper into the discussion and the planning, we knew that we had to reach out to our people that weren't on reserve. We have people in Merritt, Kamloops, Kelowna, Vancouver, Calgary, Toronto, Newfoundland, Washington State, California. And we reached out to them. Are you okay? How are you doing? Do you know where you can get your supports? And made connections for them to be in the loop where they can get supports or get more information on what's happening in their local area. A lot of work. But what it did is it brought people into the community that we haven't heard from for a long, long time. And also, while we're doing all of this, we started connecting with our children that are in care. How are they doing? How's the household doing? How are the individuals? How are the kidlets doing? And it really gave me awareness about where our people are, where they're at, the supports that they needed over and above what they were getting from the province or from the feds or from the local community that they lived in. And it was so amazing to be able to connect, especially with the children in care and their caretakers, and bring them a little closer to home. And as we continued our lockdown, I live right next to my mom. And I talked to my mom. I told Mom, you got to stay home. You can't go to town. You can't go visit people in the community. Just stay home. And I noticed that she was still going for her walks, and people were phoning me and saying that your mom is visiting and she's coming into the house and really not comfortable with that. So I went and had a talk with my mom, and she didn't understand. The elders didn't understand, what was going on. And in order to explain it to my mom, I told her what was happening in Italy. The number of cases in Italy, the number of people that were passing away because of COVID, because of the pandemic, and that we really got to take it seriously. And it clicked. She says, I thought this was only here in Gulshana. I told her, no, this is worldwide. So please stay home, Mom. Phone me if you need anything. And it clicked with Mom because just a few years ago, her and I went to Rome to visit the Pope. That was her words. We're going to go visit the Pope. So she understood. And while doing the work like I'm doing right here now, I can see. And I noticed Mom wasn't going for her walks anymore. So I went and I phoned her and I told her, you're not going for your walks. You should get out and go for your walks, but just don't go in anybody's house. She says, okay, click. She hung up, and then I seen her walking. And we noticed that all the work we're doing, and we're really busy. Each and every one of us, we're really busy. We're still not hearing, from the homes and the families. So we set up a network where each household was phoned. You got a phone call. How are you doing? Do you need anything? And that's for the people on reserve and people that didn't live here. Or we had some people living in Europe. We made connection with them. So it was a regular, every day we had a team phoning our people just to make sure they're okay. And then as we got into it, we noticed that, hey, we've got to do something about food in the house, essentials. Then we reached out for help. Yeah, we got some help from EMBC. We got some help from the health authority. We reached in and got some support from our local child care agency to help our people that were in care. And we're able to do some grocery box drops in each and every household. We did that 4 times during this pandemic. And the other segment that we kind of lost contact with and didn't reach out to were the people that lived on the streets in Vancouver, here in our own local town. So we had individuals from the areas go and visit our people that were living on the streets. Are you okay? No, I'm not. The whole world changed for them as well. So there's a lot of networking that needed to happen and a lot of understanding about what we were in. And while we're dealing with all of this, from March, about 5 weeks later, we had to include in that emergency order flood. Our community started getting flooded. So not only were we dealing with COVID in the pandemic, but now we were dealing with people getting flooded out of their homes. And what are we going to do with them? Oh my God, it was craziness. Just last week, we had our final family move back into their home. We finally got their house all fixed up after the flood. So it was a lot of craziness and a lot of awareness and us realizing that what's really important for me, it reconnected me to my family, my children and my grandchildren, my mom, my brothers and my sisters, really afraid for them. And I know that was widespread through the community. So in a way, it brought us back together again. And that is, it was something that we all wanted, to bring our families back together again and have family look after family. And we've seen that and we witnessed that. That was one of the gifts that we got from the pandemic. I could look at all of the things that didn't work, but one of the biggest gifts that it gave us is that it reunited our families. Because like in all of our communities, we're going and facing a lot of challenges, a lot of personal demons about our history, about the impacts that it had on their lives and their families. And we knew that we had to be there for them. While we were doing all of this and being busy and organizing and communicating and a lot of paperwork and a lot of administrative stuff, I met with our health director and had a chat with him and just getting an update from his perspective on how was our community doing. And we had a good chat, yeah, this and this and this and this. But one of the things that struck me was that there was a lot of talk about suicide. And I said, really? And he said, yeah. Our health staff and our support staff are dealing with this just about on a daily basis. People really concerned, people grieving, people being hurt, people feeling isolated. So you can see that the impact of being separated from your family, being enforced to stay home was having a really big effect. And I thought about our youth. And he was looking at me and he said, no, it's not our youth, it's our elders. And I said, yeah, they're hurting. Our elders are the ones that hold us together. They're the ones that go and visit and talk and be with one another. And isolating them was really impacting them. So we had a plan of it's not what I can say or what our people say on the live broadcasts on Facebook or the newsletters or letter drop-offs at the house. They needed the one-on-one, face-to-face contact. So we had to put a little plan in place of where we were reaching out to all of our elders and having a visit with them, from their door from me to the car. And that was a huge relief for them. At least they were having some connection with the outside world. So it's been a real challenge, but at the same time, we know and are prepared for really developing a more close-knit community. We care about one another. As we grew over the years and we're dealing with the social ills that we all carried, we came isolated. It was okay to be alone in your house. It was okay not to connect with the outside world. But a lot of them walls and barriers were taken down. It was taken down because one of the things that I and a lot of other people in this community had a hard time doing, and that was asking for help. I need some help. Can you help me? And when they asked for help, the first words that came out when he finished saying help was a lot of tears. You know, I'm not used to doing this. I can fend for myself. I can take care of myself. But people started asking for help. And that in itself brought some healing into our community. We are by no means over. We still know that we have a lot of challenges. But the communication lines that we had to open up amongst ourselves and of course with the outside supporting agencies was huge. And I know that the community is going to become closer. Just knowing that they're going to be okay. Just knowing that their children that live in California are going to be okay. Just knowing that their children, one of them lived in Germany, she's going to be okay. So it's been a whirlwind. It hasn't been easy. Like Chris mentioned, our frontliners are on the verge of collapse right now, and we're looking to find ways on how we can support, bring more of our people up, and have them man the stations that need to be taken care of. So a lot of our people in this community are stepping up and filling the role of the roles in the emergency ops center, getting the training that they need. I remember, and this was in late March, just dealing with the pandemic and the virus. I got a call from a young lady that was really sick. I said, don't go anywhere, don't go to town, don't go to the hospital, we'll deal with this. And I phoned the health office and we phoned her doctor. The doctor says, bring her into the hospital. We phoned the hospital, and there were a number of things that we had to do to prepare her to be picked up in an ambulance. And that was going to take some time. While we were talking, one of the health workers, staffers, says, "Don't worry about the ambulance. I'll take her." We got her prepared in the personal protective equipment, went over and picked her up and brought her to the hospital. And when she got back, she went into 2-week isolation. So it's dealing with things like this that we weren't really prepared for. Yeah, we were prepared, but not really prepared for this. And now I know that we are a stronger community. We're a more close-knit community, and we are supporting one another. Something that we haven't done for a long, long time, to support one another and to have empathy for one another and to have some respect for one another. We've been quite fortunate to have no an outbreak here in our community. We've had no incidences of anybody testing positive. We had a lot of people get tested. Me, for example, I got tested twice, but all came back negative. So we are surviving. We are finding ways to help one another, and as a community, coming a lot closer. So with that, White Limerick, thank you.
Thank you for that, Chief and Council. My name is Manny Jewells. I'm speaking to you from my traditional home here in Kamloops, right on the former Kamloops Residential School. I want to quote from a book that really inspired me early on during this pandemic. John M. Barry's The Great Influenza, the epic story of the deadliest plague in history. Those in authority must retain the public's trust. The way to do that is to distort nothing, to put the best face on nothing, to try to manipulate no one. Lincoln said that first and best. Leadership must take whatever horror exists concrete. Only then will people begin to break it apart. I reread this book early on during the pandemic to find out what happened and how people responded during the Spanish flu influenza. My grandfather, Joe Jewells, lost his first wife and 4 children in the space of a week of November the 5th in 1918 here in Kamloops. I was also interested in what happened here in my little community and how the local community of the city of Kamloops responded to our needs. I was really happy that the Royal Inland Hospital accepted people from my reserve to the hospital in 1918. I was a little bit worried because some of the reports that I'd read about the Spanish flu was that they were barricading and closing down the city and keeping out all foreigners, i.e. people from outside the community. And so we had a personal story about what happened during a pandemic directly from our oral tradition. Like all of you, we were very busy. I traveled every week to all parts of the country and to New Zealand, the United States. As a matter of fact, I just come back from the United States, from Oklahoma, earlier on in the year. I was planning on going back to Minneapolis, St. Paul to address a conference about 2 weeks after the country shut down. One of the last meetings I went to was the Southern Chiefs in Manitoba, March the 10th. As all of us were waiting to board the plane in Kamloops, the plane was delayed. Then we heard word that 2 people on the plane were really sick. And so it became real when the ambulance went out on the tarmac to meet the plane. The doctor was there, people dressed in hazmat suits. Everybody rushed up to the windows to look and see what was happening. It was at that moment that I realized that this was no ordinary situation. We went out to Manitoba to address the chiefs because that is a critical component to helping the communities in Manitoba deal with the economic situation that all First Nations have and have had since the advent of the Indian Act, and the complete divorcing from our jurisdiction and the ability to be able to look after ourselves completely. My address to the chiefs was looking at the reality of what is gonna face us. And the fact that we didn't have any resources and not enough resources to be able to look after ourselves and to be able to look after our people. What COVID-19 has done is it's exposed completely our dependence on the federal and provincial governments for transfers. To be able to look after oneself is critically important, as the 2 other representatives have talked about. And the ability to be able to do that still isn't with us today. And it's because of the Indian Act. It's because of what people are now calling systemic racism. You need look no further than the Indian Act to realize how dependent we are and how utterly despondent it is when we have to confront the reality that we have to depend on somebody else to give us a program. Programs are not jurisdiction. Programs are secondhand taxes that someone else has created, someone else has made the priorities for and said, this is how we'll address this situation. I started to read a number of books to think about what was going to happen post-pandemic, but also to take me through this incredible journey that all of us globally are in. We lived through SARS. Fortunately, that was just a blip, really, when you look at what COVID's been like. And when you think about, as I did, the response of our elders, particularly of us here in British Columbia, the smallpox epidemic had wiped out 3/4 of our community in 1862-63. It really set the stage for the colonial government at the time to take over jurisdiction within the province of British Columbia. It allowed the federal government to exert its jurisdiction over our traditional lands. And ultimately, it led to what I believe the Canadian government is operating its economy on, which is once we were placed on Indian reserves, they were able to exert their jurisdiction within our traditional and treaty territories and take over all aspects of our life through the advent of the Indian Act. I want to read a couple of sections of a memorial or a statement that was made to Oliver, who was the Minister of the Interior and therefore the Minister of Indian Affairs, and on July the 16th, 1910. We want a definite understanding regarding lands, water, timber, game, etc., with the governments. And we consider other such matters such as schools, doctors, and aid to the aged, Indian funds, etc. When I read those initially many years ago, I didn't place it in its proper context. My elder chiefs, Johnny Chalhitsa from Harvey's community, my chief, Chief Louis from Kamloops, What those chiefs were talking about in 1910 was not education in terms of the residential schools and what that's wrought within our communities. What they were talking about was control of education so that we could in turn educate doctors to look after our aged, to look after our communities. They were talking about jurisdiction over all of those aspects that are still with us today. Lands, water, timber, all of those are jurisdictions that have been forcibly taken away from us through colonization. They asked for an extension or an expansion of our reserve lands. Most of our reserve lands, even today, aren't enough to look after our communities. We asked that those lands be sufficient enough so that we could compete with the whites. At the time this Indian Act was affecting us, we couldn't trade beyond the borders of our reserve lands. We couldn't trade the produce that we grew. It wasn't until the 1980s that the Minister of Indian Affairs changed that through an order in council so that you could legally sell produce outside of reserve lands, whether it be grain or anything else, even though that was happening. We asked for the permanence of a pure or a permanent and secure title to our lands. Even today, Indian reserves are still owned by Her Majesty, Queen Lizzie. She doesn't know that she owns so much land here in Canada. She doesn't know that the impact of her ownership of our lands means, because of two particular sections of the Indian Act, we can't secure loans, therefore we can't build our own homes. We build disposable homes on Indian reserves because in effect, we don't own them, the federal government does. There's no individual right to that house other than the fact that we might have in some communities a right to possession of lands. We can't securitize loans, so therefore we can't be bonded, can't get into small business. That's why a lot of our communities have developed development corporations. Again, stepping away from our role as legitimate governments. And so ultimately we have to make a decision on whether or not we want to act like a corporation or act like a government. What we've seen during this pandemic clearly is the federal government has got a credit rating. That's why they've been able to give lots of different programs federally to both provincial governments, First Nations, municipal governments. It's exposed the kinds of credit that both the federal and provincial governments have got and First Nations don't have. It's because they're able to go to the international bond market and lever their jurisdiction and their taxes, TAKSIS, to look after Canadian citizens. And of course, the priority right now has to be the health and welfare of its citizens. And we're asking for the same thing. When we analyze the expenditures from the federal government to First Nations, unsurprising to a lot of you, will be that our expenditures lag behind the rest of Canadians to the tune of 60%. 60% were expended on First Nations. That's atrocious. That's why you've got communities that are completely dependent on programs and not through the ability of utilizing our jurisdiction to be able to look after ourselves as our ancestors asked for in 1910. Then we asked and told the governments that it is our intention to support financially the movement here in British Columbia to deal with our land and title. What did that get us? That got us an amendment in 1927 to take away our ability to raise funds from ourselves through self-tax, so that we wouldn't fight the question of title here in British Columbia or our rights. All during this time, we weren't considered citizens of the Canadian people. Our citizenship, even though we fought in the Boer War, the First World War, the Second World War, we have to pay homage to those veterans, because without them fighting for us, we wouldn't have had the vote or our citizenship in 1958. Leading to our vote, leading to the modern movement today, which rejected the first Trudeau's white paper policy to assimilate us. So these struggles were brought back to me like a lightning bolt in the early phases of this pandemic. It reminded me that what we're talking about today, in the words of Yogi Berra, it's deja vu all over again. We're looking at an infrastructure deficit of up to $30 billion. We're looking at a fiscal deficit of up to $31 billion. A credit deficit, because of the Indian Act, of $175 billion. A STEAM education deficit. And what I mean by that is there are potentially 75,000 potential students that could be taking sciences, the technologies, becoming engineers, because of the lack of equality in terms of provincial funding in the education system on reserve and indeed off reserve. The trade exports, $12 billion. What we need to do and what this pandemic opportunity provides us is a mechanism to change all of that in a very fundamental way, so that our people can be the productivity within our communities will be increased. Even right now, through the work that we've been doing through real property tax, we collect as First Nation governments about 110 million on an annual basis. Yet over these same properties, the federal and provincial governments collect $700 million. There's a huge imbalance there. Now is the opportunity to begin to think of the proper place within the Canadian economy, within the Canadian healthcare system, post-pandemic, and indeed going through it. There's going to be a First Minister's discussion just in the next little while between the Liberal government and the provincial premiers. The first item on the agenda, obviously, is going to be health. How are those health monies derived and how are they expended? One of the things we're advocating right now is our development of a First Nations Infrastructure Institute, so that we can begin to build better infrastructure within our communities, build better roads, build better schools, build better healthcare facilities. We've got to be able to take this opportunity to change legislation so that we can be a part of the fabric of the recovery post-pandemic, part of the fabric of dealing with healthcare, dealing with education, and harnessing the incredible imagination that our youth have. One of the things that I've learned throughout my life is innovation. Innovation is one of the most incredible gifts that we can bring to the betterment of life here on this little planet. It's the stuff that's between our ears. that can make the biggest contribution. And so we're going to get through this. We don't know at what cost. The United States is not a good example to look at. New Zealand and other island countries have been very successful in containing COVID-19 because they're islands. Here in Canada, we've got to be able to work together. And still today, there is no national strategy. So there's a lot of work to be done. All of you that are public servants are an incredible part of the machinery of government. Listen to the words of my ancestors, asking that we be part of this economy, putting us in a position so that one day we'll be able to educate more doctors, more scientists, so that we can be a player in the global economy as well as the Canadian economy. As Harvey and Chris have talked about, the way we're going to get this is by relying on our families. And Canada is a big family. We're all related. Just this morning and last night, we heard word that a couple of our elders were in an elder home here in Kamloops that now has one of its employees that had COVID. Just learned this morning that one of my nephews just tested positive with COVID. So it's in our house. Indeed, many Canadians have passed away. Too many, particularly our elders. We don't look at our elders as being expendable. We don't look at any segment of our population as being expendable. Indeed, they're all important because particularly our elders, they're encyclopedias. They're our teachers. And when we look at the youth, they're our future. It's like when I look up at the heavens, I look at the grandfather star, the North Star, and I know through the constancy of that North Star that we're going to be all right. And when I think about my Maori brethren on the South Island of New Zealand, and when they look up in the heavens and they see the Southern Cross, I know they'll be all right as well. Because throughout humanity, the only thing that makes us and distinguishes us is our ability to innovate and our ability to be able to help one another. Thank you very much. Be safe, look after your families, and make sure in your policy deliberations, think about First Nations and our proper role within this great Canadian Federation.
Thank you. And we are at time. I wanted to make sure that we heard everything that our wonderful panelists had to say today. So we unfortunately don't have any time for questions, but I do want to thank all three of our panelists today. I raise my hands to all three of you and to your communities and to the work that you are doing. Thank you so much for coming today. And thank you all of you for listening. I turn it back over to your co-chair, Gilles. Thank you so much.